Gerald is an example of a small business owner who will benefit from the new law. He's owned his company with 8 employees in his community for several decades now. He offers health benefits to employees despite knowing it puts him at a competitive disadvantage compared to some of his competitors who don't offer benefits. But Gerald believes healthy employees are essential to a productive business, and he thinks employers have a stake in doing what's right to make sure they can keep their employees healthy. At the same time, he finds he has to cut benefits every year to keep up with insurance premium increases and still turn a profit. He's not sure how much longer he can keep it up. But when he found out about the tax credits his business is eligible for this year, Gerald was thrilled. He hopes participating in the exchanges and the other changes that will be implemented because of the new law will allow him to keep health benefits affordable for employees and the business. Then he can feel secure in knowing that he's able to fulfill his responsibility and do what he can to keep his employees and his business healthy. Now, even with the initiatives to expand coverage, regulate the insurance market, and promote shared responsibility, it's only by controlling medical inflation that these plans will be financially sustainable in the long term. The most important thing to consider in order to successfully accomplish this is how we actually deliver healthcare services, because the delivery of medical care is what ultimately controls the cost and generates value. We know how to do a better job of preventing illness and providing better care for chronic and costly medical problems like diabetes and high blood pressure. Data from our own nation and internationally shows us the further we move along this continuum towards well-coordinated, patient-centered primary care, people are healthier and costs are lower. This type of high-quality primary care provided by the doctor and medical team you choose for your family should be what everyone has access to when they need it. But this is too often not the case because financial incentives do not reward it. Increasing access to more efficient, effective care such as this requires a reorientation in the economic incentives in medicine and support for innovation in care. The new law begins to pay more for the value offered by good primary care and will start to foster innovation through pilot projects that modify payments to hospitals while encouraging well-coordinated team-based care delivery that can produce better outcomes at lower overall cost. These are small steps in the right direction, but if these initiatives prove successful, they must be expanded rapidly to transform our healthcare system towards paying for quality rather than just quantity. Another strategy to control long-term medical costs is to promote disease prevention, encourage healthy lifestyle choices, and to beef up our public health efforts. The new law will require Medicare and insurers selling new policies to offer first-dollar coverage for preventive care, meaning no copays on these services. It'll encourage premium discounts for participating in wellness programs and require chain restaurants to publish calorie and nutritional information so Americans can make informed choices. It will require employers to accommodate breastfeeding mothers. It also invests in our fragile public health system, which plays a critical role in disaster planning and protecting us from epidemics of infection. Now, of course, health insurance is no good if you can't find a doctor to see you. Many Americans have trouble finding a doctor today. Primary care doctors are in especially short supply. In fact, the American Association of Medical Colleges estimates a nationwide shortage of over 125,000 doctors just 15 years from now. There's an even bigger projected shortage of nurses. The new law will begin to try to address this burgeoning problem of access to care by increasing funding for the National Health Service Corps, a program in which doctors work in medically underserved areas in exchange for repayment of their medical school loans. It will increase funding for community health centers, which are on the front lines, reaching communities across the nation with unmet medical needs. It will begin to open up training space and consequently increase funding for primary care specialties. And it works to relieve the major bottleneck in nursing training, the lack of nursing instructors. Although these are welcome initial efforts, with such a large gap between supply and demand looming, it's clear that there's much more to be done to make sure we have the 21st century healthcare workforce we need. Now, Americans are appropriately concerned about the financial health of our nation, so it's important to talk about how all of this is going to be funded. Starting in 2018, there will be a tax on high-cost insurance plans, those with premiums over $27,000 annually. There will be a tax on tanning salons, which incidentally were shown to be associated with a higher risk of skin cancer than natural sun exposure in a recent study. Medical device companies and insurers will also pay additional taxes. Those who make unearned or investment income over $250,000 per year will pay additional tax. High-income earners with an annual income over $250,000 for a couple will notice an additional Medicare tax deducted on their pay stubs, and they'll have to pay a slightly higher Medicare premium. Savings in Medicare, particularly by reducing corporate welfare payments to HMOs, are projected to make up much of the needed funding difference. The Congressional Budget Office, or CBO, is a nonpartisan group of economic experts that lawmakers of both parties rely on to be the referee on cost projections of legislation. Considering everything in this law, the CBO estimates it will actually reduce the federal budget deficit by $124 billion over the next 10 years. They also project average insurance premiums for most Americans who have and keep coverage through their employer will not be significantly changed by the legislation. Insurance costs should go down for those who participate in the exchange or receive tax credits or subsidies. So that all sounds great, right? Are we done? Did this law fix everything that needs fixing? Well, unfortunately, the answer is no. I would have liked to have seen many of the major components implemented sooner. Even under the new law, there will be over 20 million Americans left without health care coverage. More must be done as soon as possible to comprehensively address the workforce shortages we face. And finally, despite the fact that many of my patients will benefit from the things in the new law, you'll notice I did not say that health care costs will drop for most Americans. We still haven't changed the shape of the curve that I showed you on the first slide. I believe our healthcare system will continue to be broken until we fix the root of the problem. The fact of the matter is, despite spending more than any other nation by far, we did not get good value for our money. This is because we haven't set up the rules of the game to reward value. As I mentioned, our healthcare system pays for quantity, not quality. To fix this, we must make the primary goal of our healthcare system preventing disease and producing the best health, rather than just producing healthcare services as commodities. This new law will allow us to take the first steps down the road to where we need to be, but our journey has only just begun. It's critical that we understand this and that our legislators understand it as well. We can debate about how best to get to our destination, but we must overcome the divisiveness that today's politics and media feed and build consensus to continue our journey, because it's clear even now that we cannot stay where we are. You know, when it comes down to it, we all want the same things. We all want to stay happy, healthy, and productive as long as possible. And we want the best healthcare in the world to help us do it. We have finally begun as a nation to shape a healthcare system that works better for all Americans. But successful implementation and further transformation are critical. At this important moment, we hold our future in our hands. If we successfully come together around a better vision and implement solutions that work, we will lay the foundation for a more secure healthcare future for ourselves, our children, and for generations to come. Appreciate the opportunity to talk about these important issues that I care deeply about as a physician and American. And I want to leave you with these action points. First of all, I hope everyone learns something by looking at this today, and I hope you continue to listen and learn and educate yourself. Advocate for affordable health care that prevents illness and delivers better health. Don't keep this information to yourself. Talk with others in your family and community about these issues. Pass it on. And your voice and your vote are important. Use them. Tell your legislators what you think and become a healthcare voter. Finally, if you have questions that aren't answered here tonight, you can go to the web at www.askadoctoraboutreform.org, and there you can submit questions and get them answered by a member of Doctors for America. Thank you very much for your time.